Hello, everyone. I am Alice Teall, and I'm an assistant professor of clinical nursing at Ohio State University College of Nursing. I'm also the director of Innovative Telehealth Services and the director of graduate academic wellness programming. I'm really happy to be joining all of you at this conference. I'm thrilled to be speaking with you about telenursing, a new way to deliver care. And as I start this presentation, I want to recognize something about the title, and it's this. Telehealth has actually been around for a really long time, for decades. It's just that we didn't use it widely, and we didn't use it to really increase access to care. And actually, until the pandemic, we didn't really have all of these innovative ways to use telehealth technologies. And so that's what I'm going to speak with you about today. And we're going to look at telehealth, telenursing, and about all of the really amazing things that we can do using telehealth technologies. Okay. So first, let me start with some definitions. I tend to use telehealth and telenursing and virtual care kind of in very similar ways. There are some subtle differences. First of all, telehealth is the broadest of terms. It's defined as the providing of health services or virtual care through telecommunications technologies. So it is really broad. Telemedicine is the diagnosis and treatment of illnesses virtually. So when we talk about telemedicine, we're talking about a way to manage care versus telehealth, which is really broad. Telenursing then is the delivery and management and coordination of care and services using telecommunications technologies. In a kind of informal way, when nurses use telehealth, I tend to call it telenursing or telehealth. But I think it's important to recognize that telehealth includes more than virtual visits. Virtual visits or e-visits are web conferencing type visits, sort of like what we're doing in Zoom for this conference. So they're live, same time I might be talking to a patient on the other side of a screen or who's joining me in a Zoom conference. And that is a type of telehealth visit called a video visit or a virtual health visit. But telehealth is more than that. It also includes the use of smartphones or web portals or biometric devices. And so you see all of these categories on the screen. I'm going to go through these a little bit. So video conference, like using Zoom or web conferencing, that's a synchronous visit or a virtual visit. Telehealth also includes store and forward technology, and that's the use of technologies to, say, send someone a picture. On this slide, you can see that it looks like the nurse is looking inside someone's eye. The camera, the digital camera being used, can take a picture of that, and that picture can be sent to an ophthalmologist for the ophthalmologist to review that internal eye exam. That's called store and forward technology. We also have remote patient monitoring, right? So a patient might connect to a type of technology where an EKG might be sent to a provider's office, or we might be able to have them connect to a technology to tell us about how well their pacemaker is working, or a person in this picture, you can see she's just using a monitor to get a blood pressure and a pulse, and that can then be sent through what we call a patient portal to the provider, so the provider can know how their management of hypertension is going. And there's also mobile devices, and I touch my wrist because I'm wearing a Fitbit, and there's a lot of data you can get from mobile health or M Health devices as well. And then we also use telehealth and we practice telenursing using provider to provider consults, meaning that you can use web conferencing to collaborate with another nurse, with a physician assistant, a nurse practitioner, someone else across the healthcare team. So all of these things are telehealth. They're all ways that we use technologies to deliver care. Um, Actually, there's a collaborative group of providers called Project Echo, and it has been in existence since 2003. There are 70,000 learners, 70,000 healthcare programs or healthcare providers, 650 programs in 40 plus countries who are a part of Project Echo. And I'm going to give you a web address later in this presentation so that you can connect with Project Echo if you would like. Okay. So why telehealth? What's the purpose? What's the reason? What's the rationale? Well, prior to the COVID-19 pandemic, the drivers of change were primarily the fact that our population is aging and the need for chronic care management. And I do believe that you all, as nurses, can recognize how prevalent chronic disease is across our populations. In the United States, 1 in 2 adults have a chronic illness. 3 and so many people have. And so the primary reasons for mortality in the United States are things like heart disease, hypertension, diabetes, heart failure. And so as nurses, we can reach more people and provide better care across the care continuum using telehealth technologies. In other words, if you're working with a patient who has heart failure in the hospital, rather than having that person come back into the hospital or come back into a clinic to be seen, the providers can reach out to that patient to check on them and use remote devices to see how they're doing in terms of their fluid, to see how they're doing in terms of their heart disease. You can see in the pictures on the slide that at least in 2 of the pictures, there's a nurse with the patient. Telenursing can be done either like I do it as the nurse who's at a distance, as the clinician at a distance, who's joining the nurse and the patient or the patient, or it can be done with the patient. You can be the nurse with the patient, who's then calling in or using technologies to access a physician or a nurse practitioner or a clinician. And so it's important for us as nurses to be able to be on the side of the use of telehealth from the distance as well as the person with the patient. Another way that we use telehealth to provide care are to access not only the elderly or individuals with chronic diseases, but we also access people in healthy pregnancy. We can reach people who have maybe an acute illness or we can reach out to people for follow-up. So telehealth allows us to follow up with our patients without necessarily having them come in for a visit. It's been a great way to talk to and reach out to people, again, regarding chronic care management like disease or hypertension, but also to help keep people healthy. One of the major reasons that we use or began using telehealth in the United States was to reach more people through to provide behavioral health care or mental health support. And we know that we have quite a shortage here of mental health providers. Telehealth allows us to reach out to people who might have depression, anxiety, stress, distress, to provide counseling and support for. So it's so much more efficient. Instead of the provider trying to cover lots of clinics and lots of clinics and follow up with lots of patients, it's much easier for them to connect with patients and provide help. Now, in terms of telenursing for inpatient, what you see on the slide are ways that nurses can support each other using telehealth. Nurses in the ICU can reach out to nurses who are in other ICUs to weigh in and to provide support for their care. And that's what you're seeing in this particular picture, the big picture on this slide. In the smaller picture, you're seeing a nurse faculty who's actually checking in on a student to see how they're doing. And so when we have our students out in rural areas, we reach them by telehealth. About inpatient and outpatient and healthy and well individuals, telehealth can really allow as nurses to bridge them. We find that a lot of people who are discharged from hospital have questions and don't have easy follow-up or an easy way to contact a clinician, and telenursing allows us to be able to do that. So much has changed with COVID, and I recognize that I am talking to you during the pandemic, and that pandemic has shaped many of our lives. There's a lot of uncertainty with that. One of the things that's happened in the United States as a result of the pandemic is we have increased our use of telehealth 7,000%. So nurses, nurse practitioners, physicians across specialties, social workers, counselors, we are using telehealth to reach out to our patients. So much so that the question has become, why not to have a virtual visit? It's changed from when can we use telehealth to why not provide a lot of our care, if not a majority of our care, virtually. We have patients who will drive 2 hours to come to a visit. That's not necessary if we can use web conferencing like Zoom to reach them, talk to them. It saves them time and energy. And what happens is you're much more likely to follow up. The biggest problem or the biggest reason it's not expanding even more is there's a gap because we haven't learned the best way to deliver healthcare anywhere and everywhere, right? Most of you, and as like, for example, I can say this, most of you are like me, that you probably did not have anything about telehealth in your nursing education. And so it's hard to know, like, what kinds of things do we need to do to be sure that the quality of care that we give as nurses is the same whether we're doing care in person or whether we're doing care by telehealth. And so we've worked on that at Ohio State College of Nursing. Our focus at the College of Nursing is delivering quality care and preparing nurses to deliver care that is of high quality and is evidence-based. And so we've had telehealth in our curriculum for quite a while. So first thing I want to explain about the pictures on the slide, the top two pictures, our college was gifted a telehealth station or a kiosk that is used in our educational programs. It allowed our students to familiarize themselves with digital technologies, and it allowed them to learn to provide care by telehealth. So in the top left, you see the nurse in the white lab coat, and she is watching another nurse with a patient, and she is an assistant. In the right picture, you see the nurse with the stethoscope with the patient. You see that the nurse at a distance. And so this is how we practice using the telehealth agent. We also use this agent in our practice. The College of Nursing at Ohio State has a nurse practitioner-led interdisciplinary team-based in Columbus, Ohio. And we offer telehealth care to other students and patients up to 90 miles away. In fact, during the pandemic, at the start of the pandemic, every visit in our clinic went to a telehealth visit. In the bottom picture, you see two other pictures. Those are our undergraduate and graduate students learning to provide care by sometimes the student's at a distance and she has recruited a patient so that she can show us how she's doing care. In that far right, that's a classroom of students who are talking to the patient from. So we try to incorporate telehealth in their nursing program. This picture probably looks a little familiar to you because it's a picture of lots of students in a Zoom room. And what we have done is we also now use our web conferencing for our online classes. This is the way we teach. The teacher, the nurse educator, is showing how to do the assessment of the range of motion of the person's wrist. She's talking them through that. And so we have our students turn on cameras and show us their physical exam assessments and show us how to do different techniques to get them used to using a camera. It's one way that they develop skills. Then once they get the hang of that, they've had practice in the classroom, they have practice in trying to use these, and then eventually what we have them do as part of their clinical practice is either use telehealth by using web conferencing to talk to people about the symptoms of coronavirus or some other symptoms that they're having. We even have them follow up using both their computer system as well as the phone system to reach out to people to support their wellness. All right. So in all of this, so now what you know so far is, wow, we have increased the use of telehealth 7,000% in the United States. And you know that I'm one of the faculty team or one of the nurse educators who's teaching our students to provide care by telehealth. So you may be wondering, okay, what do I need to do as a nurse? How can I use telehealth to reach my patients? What kinds of things could I think about doing? So I'm going to talk to you a little bit now about some of the considerations for like best practices. And one thing that tends to worry nurses, or one of the barriers to telehealth, are people are worried about the equipment. Okay, and they wonder, what if my patient has or doesn't have equipment? And so I'm going to talk to you a little bit about what we call digital peripherals, or the type of equipment that can be used in telehealth. The top, you see all of these small devices. They're actually small portable devices that you can take as a nurse either into the patient's home or into the clinic with the patient. And then the provider on the other side see what you're seeing or hear what you're hearing. And so there's an otoscope that the patient can actually put in their ear, and then the person on the other side of the web conferencing. That same type of technology has a device that is a digital stethoscope that connects, and the person can put the monitor to their chest, and you can, from the other side of the web conferencing, hear the heartbeat. There's a lighted tongue depressor. So what happens is you can then use these tools to be able to better see and hear what's going on the other side. Or you see the pictures at the bottom, and you see how there is a nurse with each of those patients, you as the nurse can use the peripheral, and you can do the assessment so that the physician or nurse practitioner or clinician who's at a distance can then. And so it's really important, I think, to learn the skills of being what I call a telepresenter, which is the nurse who is with the patient, as well as the skills of being the nurse who is at a distance. All of that. Sometimes our patients do not, or our clinics or our providers do not have the money for digital peripherals. And that happens a lot. And the underserved clinic that the College of Nursing runs is, I would say that what we do is we don't often have the digital peripherals. So we have three things that we tend to ask our patients to have when we do a telehealth. Have them have a thermometer, a blood pressure monitor, and a scale. And if they have those three things, I can talk to them from a distance. I can know whether they have a fever. And I can know something about their vital signs. And if they have heart failure or heart disease or diabetes, I can also. Now, if they have diabetes, sometimes we'll get a blood sugar monitor to them so we can check on their blood sugar. So, a lot of times, it's really just they have to have a smartphone or a laptop to connect to us. And these are the three things we ask them to have. I think sometimes too, people think you can't really assess or see people well from a distance, or that our exam is just way too limited. And I would suggest to you that is not actually the case. So much of what we know as nurses, we learn by observation, right? And so if you're even talking to a person on the other side of Zoom, you can learn a lot by looking at them. You can know whether they're sweaty or dehydrated. You can know if they're shaky or if they look concerned. There's a lot of physical examining to do. And if you're wondering about the logistics of that, or how you do that, I have listed on this slide what we call playlists of YouTube videos that show you how to do a telehealth exam from a distance. And it shows how to assess a person's physical, how to do a physical exam from a distance. In terms of the ear, nose, and throat exam, skin exam, abdominal exam, heart and lung exam, neurologic exam, and musculoskeletal. So I've got a link on this slide that you can click on so that you can watch those YouTube videos. One of the things that I think is very important about understanding telenursing is this. Some of the things we do really well as nurses are connected with people. And so when you begin to use telehealth, my guess is that many of you will at some point in your career. And what you want to remember is you want to do what you do well as a nurse. You want to still connect with people. You want to still reach out to people. In telenursing, we call this etiquette or etiquette. It's about how to best use what we have, right? And so you can see the nurse in this picture. She has a very simple background. The lighting is good. She's looking directly at the camera so she can convey empathy. You don't see anything around her like paper or coffee cups, right? So she has a nice, clean environment, and she's and it's really showing empathy, and that's what we want to do as nurses. Now, this might be small on this side slide, but I thought this might be helpful to you. This is a list of all of the things that we as students when they are learning telehealth. And so this checklist might be helpful just to kind of think through what are the things you need to know if you're going to do a telemedicine. Those include like being sure to be there on time, making sure that you verify the person's name who you are speaking with. You want to make sure you look at the camera and you have a professional space. There's a lot of noise in the background, and you do want to simplify what you are wearing so it's not too busy because sometimes the camera picks up patterns and it makes it hard to. You want to verbally make sure that you are avoiding jargon. In other words, keep your word choice simple and direct. You also want to know that your nonverbal communication is really important. So even as I'm talking to you in Zoom, if someone came in the room, it would be so very distracting. And so if that happened, I'd have to explain to the patient who it was and what they were doing. Um, Finally, then I would say this, that we do have problems sometimes with technology, and if that happens, just acknowledge it and just problem solve as well as you can. And sometimes we have to follow up with a phone call to be sure that our patient understood. It doesn't happen as much anymore, but we definitely. All right. So, what are some of the challenges to best practice? Well, I started telling you about one already. Technology challenges. Sometimes we think that older adults can't use technology, and I'm not sure that's the case. Sometimes even we as providers can kind of make this picture. This provider is talking to the patient. That's a problem. So when we first start telehealth, you want to take our time and learn the technology and making sure we understand how they work. Certainly, there are financial considerations. One of the reasons that telehealth was not as well implemented until after the pandemic in the United States is because it wasn't reimbursed. And so it's important to have insurance in the United States that our insurance covers telehealth, and it does now since the pandemic. And certainly, there are also legal considerations. You can't practice nursing without a license in the area that you're practicing in. You want to be sure that what you are doing with telenursing is within your scope of practice. So in the United States, I'm licensed as a nurse practitioner in the state of Ohio. I actually cannot provide telehealth for a patient if they leave Ohio and they go to a different state. So if they cross state lines and they're in Indiana, I cannot provide care for them. So we have to learn about how to work best as nurses within our scope of practice and also to advocate for policies to change so we can provide the best care for our patients. One other thing that I want to share with you is we don't want to, if we're using telehealth to increase access to care and our patients are in rural areas or they're in areas that might not have internet or they might not have the financial resources. What we don't want to do is create barriers. So, as nurses, some of the things we are doing with telehealth are trying to remove, trying to advocate for individuals who do not have the finances to afford some of and we're exploring potential barriers that we might create in telehealth. What we are doing is encouraging telehealth and telenursing to be covered by insurance. And we're reaching out to the best of our ability for our patients and our care so that we don't increase their disparity. Instead, we increase their access to us as nurses. Now, for those of you who are interested or want more information about telehealth, there is a great website. It's listed at the top of the slide, telehealthresourcecenters.org. That is located within the United States, part of the Health and Human Services. They provide a wealth of resources and how to implement telenursing, what kinds of things you need to know. And it's where you can find Project Echo, and again, over 40 countries access Project Echo and access the telehealth resource centers. In conclusion, then, what I want to say is that I recognize so many of the struggles and the uncertainty related to the COVID-19 pandemic. And that has been very true for us here in the United States. What I know about that is that we have found that we have lots of people who are not accessing care, who are not getting the medical care that they need. And we know that nurses can deliver quality care using technology. So whether that's to increase their ability to ask questions about their disease processes, or whether that's us going to where they are, providing back to clinicians, whatever it takes to be able to meet the healthcare needs of our patients, that we're going to find a way. I would invite you, as we are ending the conference and as I am ending this session, to think about ways that you might be able to use telehealth and advocate for the use of telehealth. I'm very excited to hear about any ideas that you have. I have my email address on the slide. It's Teall, P-E-A-L at osu.edu. I appreciate your attention to this topic and to this session. Thank you.